Good day to you all. In this video, I am going to show the middle meatal antrostomy, which is the initial step of functional endoscopic sinus surgery. Thorough knowledge of CTPNS anatomy and its variations in all planes is the key to safe and successful sinus surgery. The first step is middle terminate is gently medialized with septal elevator to create space for instrumentation and better visualization. Next, a ball probe is passed into the space, which is also called as a hiatus semilunaris inferioris, lies anterior to uncinate process to engage the backbiter. Using a back-biting forceps, vertical part of the uncinate is cut at the junction of the vertical and horizontal segments until we get anterior resistance. Next, a J-curate is passed into the infundibulum, the space between the uncinate and middle wall of orbit, and elevate the vertical part of the uncinate medially and anteriorly, opening the space clearly. The vertical segment is then removed with Upton Blakowski or with debrider. Engaged Upton Blakowski should be moved in inferior and posterior directions, which give good mucosal TA direction and preservation of lateral mucosa. After removal of vertical part of uncinate, the maxillary sinus antrum is identified with J-curate by introducing it into maxillary antrum in posterior inferior direction at anteriormost end of the horizontal uncinate. Do this step with carefully to avoid injury to the middle orbital wall. Naturally, maxillary ostium is always open very close to the roof of maxillary antrum. The horizontal portion of uncinate is medialized and cut the posterior superior continuity by through cut or with endosinus scissors and remove with debrider and create a wide maxillary antral opening. The two-dimensional space between the bulla and uncinate process is also called as a hiatus semilunaris inferioris. The next step is ethmoid bullectomy. The bulla ethmoidalis ostium is always opened posteriorly into retrobulbar space, and this thin posterior portion of bulla break to the J-curate, passing posteriorly into retrobulbar space and moving the J-curate posterior anterior direction and remove the bulla cell anterior medial inferior walls by Upton Blakowski or with debrider. Actually, retrobulbar and suprabulbar recess combinedly called as lateral sinus of Grunwald or hiatus semilunaris superioris. The main aims of Fess is number 1, restoration of ventilation and drainage directed to all affected sinuses, and number 2 is preservation of normal mucosa as much as possible. The same steps followed on right side. Number 1 is removal of uncinate vertical segment. The second step is identification of maxillary antrum by passing the ejaculate in posterior inferior direction at the anterior end of the horizontal uncinate. The third step is removal of horizontal uncinate segment. Fourth step is removal of bulla ethmoidalis by breaking the posterior cell wall by passing the ejaculate in retrobulbar space. In 1981, Wigan first told that Fess is the widening of natural ostium of sinuses, and he also called as Fess is a isthmus surgery. Factors that influence the post-operative sinus ostium healing are failure of reorganization of mucociliary transport, second, excessive granulations, third, abnormal lymphatic drainage, and also failure of Fess factors are persistent or recurrent sinusitis, lateral fixation of middle turbinate, injury to mucoperiosteum can induce oppositional osteoneogenesis which leads to stenosis of ostium, and therapy resistance or persistent systemic disorders like allergic rhinitis, inverted papilloma, granulomas, and ciliary dysfunction disorders, and environmental factors. Thank you.